APHA Executive Director, Dr. Georges Benjamin, is joining me now. Thank you so much for being here.
Glad to be here.
We're celebrating a lot of important anniversaries this year, so let's go through a number of them, and I'm going to have you talk about what the impact are for people. And the first is, it's the 5th anniversary of the Affordable Care Act.
Yeah, well, you know, the Affordable Care Act is our nation's attempt to cover all non-elderly citizens with health insurance coverage. From a population-based perspective, it's important. We know that 44,000 people die each and every year simply because they don't have health insurance. And the ACI is trying to make a big dent in that problem.
And now that we have seen people getting insurance and being covered and perhaps getting better health care, do you think you're seeing a difference in people's health?
I think we are. I still think we have a lot of work to do to make sure everybody gets in. And once you get your insurance card, helping you properly use it. But with that in mind, I think we're beginning to see progress.
Because before, it was just dreadful with so many people uninsured.
It was terrible. It was terrible. And this idea that somehow we have universal coverage because we have emergency departments. What I can tell you, I practiced emergency medicine for over 20 years, and there are lots of things I could do for you in the emergency department to save your life, but I could not take care of chronic diabetes or chronic hypertension or chronic heart failure. That just doesn't get taken care of well in an emergency department.
Sure, you can't keep people healthy over time. The other anniversary, the 50th of Medicare and Medicaid. So let's talk about the impact that that has had on public health.
Well, you know, Medicare has been one of the most important things that has improved the health of seniors. We're living longer because of Medicare. But I got to tell you, it also was one of the most important anti-poverty tools for seniors. It's taken more seniors out of poverty, which we know, by the way, is also by itself a health determinant. It was also very important in desegregation of our hospitals and our health systems.
It was the great equalizer.
It was a great equalizer.
All right, we're also trying to prevent cavities, and I think we've done a pretty good job of that, the 70th anniversary of putting fluoride in the water.
Community water fluorination is one of the great successes in public health. We're excited. We're in a city, which I grew up in, I might add, which has fluorinated water. And what people underestimate how bad your health can be if you get cavities, and how fluoride prevents cavities. It's a great tool, not just for your teeth, but for your overall health.
Okay, there is a major lofty goal for 2030, and that is make the healthiest nation in one generation. So what are the next steps to try to getting there?
We're focusing like a laser at the American Public Health Association on the social determinants of health, dealing with things around transportation and health, and building our communities so they're walkable, bikeable, and green, making sure that we are in smoke-free environments, doing things to make sure that we have access to nutritious and affordable foods in every community. We think those are some of the most important things to try to improve our health. We're also dealing with issues around racism and health and justice.
Well, you've got a lot of tremendous goals, and let's hope we reach them. Thank you so much, Dr. Benjamin.
We're excited about it. We look forward to it.